So welcome. Thank you for joining me live, and thank you to the folks watching the recording because I know a lot of people have asked for that. And I'm Dr. Karen Wolf, and I am trained as a physician in Australia. I live now in California, and what I do now as a holistic and functional health coach is teach people how to be well. And the topic for tonight is about understanding your lab work. And this is a topic I am particularly interested in because I love looking at labs. And I do that a lot for my clients because when we get the right labs, we know exactly what's happening inside the body. And regular labs that are just done on your annual test are usually not enough, and that's what I will be covering tonight. So my goal is to educate. It's not to diagnose or treat or take the place of any health professional, but to educate you about your numbers and understanding your numbers and maybe knowing what to ask for other things. I call them biomarkers, because to me, they are really marking what's happening inside your body. So, three goals today. I want you to learn some of the key biomarkers that are missing on your regular labs. And two, how to detect concerns earlier than what regular labs might offer, and how you can look at numbers differently than what's just normal ranges, because we're going to be talking about optimal ranges and how to take action. So, what you might do as a direct result of this webinar to help you be healthier. So, I have to start, since this is a topic that's talking about lab markers, I have to let you know that this is for educational wellness purposes only, and it's not to replace medical advice, diagnose, or treat. So you always want to work with your qualified health professional, and hopefully they have a functional health perspective, which is bigger and broader than the Western medical model, and that you'll be able to ask different questions as a result of tonight. That's my goal, is to educate. So you go and have labs done, and sometimes you don't even hear back. So you just assume things are normal, or the lab says it's normal, but you still don't feel normal. And that's because normal ranges, can you believe? Normal ranges are set by the general population. So I hate to tell you, but normal is starting to change as the population gets more unhealthy. So we're going to talk about optimal levels. And when I give you optimal levels tonight, they differ according to who you talk to. So they are ranges, and it's good for you to know that they're not always exact, but they're a guideline for you to look at. Maybe you've got your labs. I know a lot of people said they're going to pull up their labs, and as I talk, they're going to look at their numbers, or you can listen to the recording and do that as well. So these ranges are going to be very different than what you see on a regular lab report, because normal does not equal optimal. I want you to be at optimal health. And those optimal ranges are going to look very different than normal on a lab report. And here's something to ponder, because Dr. Mark Hyman is very, very accomplished in the field of functional medicine. And it's something to think about. A heart attack at 50 began at 20. So if at 20, that particular person was tracking biomarkers, something might have appeared that they could optimize their health earlier. Alzheimer's at 70 started at 40. The loss of independence at 80 began at 30. And the aging you want tomorrow begins with the choices you make today. I love that. So knowing your biomarkers and knowing what's actually happening inside your body can really help set goals. And that's why I use this a lot with my clients, is knowing where we are with numbers and being able to set a wellness plan and then repeat the numbers and look at the tracking of how you've improved. So I'm going to start off. Now, I can't go through all the biomarkers tonight, but I'm going to pick ones that are most often missed. And in the area of metabolic and cardiovascular health, these are numbers that are super important. And before I look at actual numbers, I want you to understand that you want to look at trends. So when I have a client that has some lab work and we look at labs, and if one is not optimal, I will always ask, well, what was it last year? And what was it the year before? What's the trend been? So that we can look at what's the trending of the biomarkers over time. And a lot of the portals that you have with your lab work, luckily, does show trends. You can click on a number and you can see what the result was last year and the year before. It's very clever how you can do that. So nothing happens in isolation. And a lot of biomarkers are related to each other. So that's also super important. And I just hope that you'll learn something tonight that's different and that's a wake-up call to something that you can take action with. So, in terms of metabolic markers, the very first one to talk about is fasting glucose. So, when you have a fasting blood test, they'll give you a what's called fasting blood glucose, and it's one point in time blood sugar measurement. And a lot of the lab ranges, and a lot tonight, what I'm going to give you is what lab range normal is often 65 to 99, but optimal is 70 to 80. So if you're feeling like you have an afternoon crash or you're waking up at 3 a.m. in the morning, the pre-diabetic level of fasting blood glucose is 100, even though diabetes is not set to 125. So somewhere between 100 and 125, we're working towards pre-diabetes. So we want to see what was it last year and what was it the year before. And as you'll see, there's some other markers around blood sugar that are important to look at as a whole, because fasting blood glucose just tells me what your blood sugar is on that particular day. And you might have had a pasta dinner the night before, and that's going to affect your blood fasting glucose. So you never want to look at one number in isolation. But these numbers, I really like your fasting glucose to be around 70 to 80. But then how hard is the body working to keep that glucose at that level? And in comes the hormone insulin. Insulin helps regulate blood sugar. Insulin is very rarely tested. In fact, it's never tested. Even in diabetics, they don't often test it. Now, I'm going to tell you at the end of this how you can get some discounted labs done, because I'm very aware that a lot of these tests are expensive and insurance usually doesn't cover them. So just bear with me. I'm going to teach you the ones first, and then we're going to talk about how you can get some discounted tests done. So the lab ranges are 2.6 to 24.9, but optimal is less than 5. I don't want your insulin to be so high trying to regulate blood glucose. It tells me how hard is insulin working to keep your blood sugar at that level. And a high insulin is fat storing, and it also pro-inflammatory. So it creates more inflammation in the body. So maybe you're hard exercising well, you're eating well, but you're still not losing weight. Well, it might be that hormone insulin that is holding on to weight, or you feel puffy and inflamed for no particular reason. So at 9, which would be in a normal lab range, your metabolism is already compensating for insulin resistance. So insulin is a very important number in the metabolic equation to see where your body is operating. But then there's another number, which is also not usually tested unless you're diabetic. Diabetics know about HbA1c. This is your average blood sugar over the previous 3 months. This is a way better indicator for me of how well your blood glucose has been controlled than just your fasting blood glucose. And as I said, it's never tested unless you have diabetes. So another one that I think we should all know, because when our blood glucose is unbalanced, we are setting ourselves up for metabolic disorder. But you don't know if it's unbalanced unless you know these biomarkers. But insurance is not going to pay for it because you've got to have the disease before they'll pay for the test. We work in a disease model, not a preventive model. And that's why we're talking tonight, so you know which ones to ask for. So this HbA1c is always a very small number. So 5.6. You might be at 5.6 and not a concern apparently, because lab ranges are less than 5.7 is normal. but optimal is 4.8 to 5.3. And I'm here to tell you, I rarely see that number because in the kind of lifestyle that we live, that is tends to be on the higher glycemic side with pasta and rice and bread and stress, by the way, because stress does trigger blood sugar rises, then you often don't see this optimal range. But if your blood sugars are out of balance, you can get brain fog that you can't shake, the midline body fat that you can't shake, and then the downstream effects of on hormones and inflammation and body composition that blood sugar has. So the metabolic markers are fasting blood glucose, insulin, and HbA1c. So, and again, these last two are not usually tested. Okay, so let's talk about cardiovascular markers because heart disease is the number one killer of men and women. So how do you know your risk for heart disease? And again, I'm going to tell you there's no single test. You want to see the tests as a whole. Every year, 800,000 Americans have a heart attack, and nearly half of them have normal cholesterol. Normal cholesterol. Yet we're so focused on cholesterol as a number that we miss some of the other biomarkers that are super, super important. And I'm going to list these, and these might seem really strange to you, but that's okay because if you listen enough or you take a little picture of this and you commit it to memory, then they'll become second nature like me after a while. So the heart risk tests outside of your cholesterol panel that often gets missed is HSCRP. That stands for highly sensitive C-reactive protein. So what that is it detects inflammation that drives heart disease. Because remember I said to you that half of the heart attacks in people have normal cholesterol, something else is going on, and one of those things is inflammation. Inflammation can be caused by many things, one of which is blood sugar imbalance. So the blood sugar markers are crucial indicators as well for heart health. Homocysteine. This is a really important one that gets completely missed. And there is a genetic marker in some people that would give you a high homocysteine. So I like to measure homocysteine because it's to do with the methylation pathway, which is crucial for DNA synthesis and repair. And if you have a high homocysteine, that means you're not processing B vitamins properly and that they're crucial to DNA synthesis and repair. So it also identifies plaque risk. It's a major risk factor for heart health because of the inflammation and the blood vessel damage. But we'll talk more about this. I'm going to go into each one of these soon, but I just want to give you the lay of the land of what markers we're going to talk about because my guess is these may not be familiar to you. LP little a. I bet many of you have heard about it's what we call it LP little a. That's how we refer to it because see, there's a little a. It's lipoprotein A. Now, this is a genetic risk factor for heart attacks. And we are measuring it now because it gives us an overall understanding of risk for heart disease and it helps implement a wellness plan. So if you have a high LP little a, that puts you at a higher heart disease risk, we might be more aggressive with our wellness interventions. And then ApoB, you're going to hear much, much more about ApoB. In fact, it's being considered the new cholesterol because it's that important. Apolipoprotein B, apolipoprotein B, and that measures the total atherogenic, that means atherosclerosis particles. So these are four that you will be hearing much more about. If you've never heard of them, I bet now that you're becoming aware of it, you'll probably be reading much more about it, but we're going to go into each one. So let's talk about homocysteine. Homocysteine is never discussed, and lab ranges normal is less than 15, but optimal is less than 7. If you have a high homocysteine, and I do have the genetic SNP, that means if I do not take appropriate action, to reduce my homocysteine. My homocysteine was at 17 at one stage. And so I had to take homocysteine supreme, which is a supplement that works beautifully to bring your homocysteine down. And if I had kept it at 17, it puts me at great risk for heart disease and inflammation, ages you faster. You forget words mid-sentence and the heart markers. It interferes with your heart health. So again, tonight is simply about giving you a big, wide open field to understand these markers that could potentially, if you had them measured, it could explain some symptoms that maybe regular lab tests do not. And that's my goal, is to educate. HSCRP, if you remember, that's called highly specific CRP, C-reactive protein. It's a measure of inflammation, a generalized measure of inflammation. So if you have a high HSCRP, it means you have inflammation somewhere in the body. If you have an active autoimmune condition, HSCRP is probably going to be pretty high because it's inflammation in the body. So it's a good one to mark. Say yours is 1.8, probably wouldn't be flagged because lab ranges are 0 to 3.0, but optimal is less than 1. We all have a little inflammation because we live in this world, but less than 1 is optimal. And if you have a higher CRP, you could have aching joints, your workouts could be exhausting you, and your hormones can be interrupted, many other things. But it's one of those markers that it's getting tested much more because of the understanding of inflammation being a root cause of nearly every health condition. So that's a good one to ask for. Then there's your HDL. So you probably you heard HDL referred to as your happy cholesterol or the good cholesterol. So the numbers you want in women, so low HDL in men is below 40 and in women is below 50. So this is a carrier. It carries other cholesterols out of the body. That's why they call it a good cholesterol. But you also want your HDL looked at in association with other factors like triglycerides. So high triglycerides, insulin resistance. So we look at our liver function tests and insulin that I talked to you about. Abdominal fat is a clinical sign, high blood pressure, high blood sugar, all of these we want to look at. And there's one particular measure, because I mentioned high triglycerides. You want to look at the triglyceride HDL ratio, and you want that to be about 2.0, below 2.0. So triglycerides, even though it's under the fat lipids, the main cause of increased triglycerides is high blood sugar, eating too much sugar. So if your triglycerides are 70 and your HDL is 70, then your triglyceride to HDL ratio is 1, and that's good because you want it to be less than 2. So if you have your lab workout and you're looking, have a look at your triglycerides, have a look at your HDL and see what your ratio is, because that's a very important factor in heart health. And that's something that I look at when I look at your labs. I will look at that ratio as well as the HDL and the LDL, all the lipids. So I talked to you about LP little a, LP little a. So let's talk about that. 1 in 5 adults have a high LP little a. Most have no idea because it's never tested, although it's more and more becoming something that's tested. Thank goodness. So it's genetic. You inherit it. You don't earn it. Standard cholesterol tests miss it. And high levels do drive serious disease. So if you're looking at your labs and you don't see LP little a, chances are it wasn't tested. So you want to ask for it the next time you have lab work. Why it matters. It is one of the strongest predictors of heart disease. And it allows us to take action earlier. If you know that it's high, then we want to be more aggressive in our wellness initiatives towards our heart health. So you want to work with your healthcare provider for a personalized plan about your heart health. You can't change your genes, but you certainly can change your future by understanding all these biomarkers as a whole. So that's called LP little a. And have a look at this. LP little a is 6.6 times more damaging than LDL. Almost nobody tests for it. Now, you might be someone that says, well, I don't want to know if I have that. Well, think of it this way. The major side effect of a heart attack is death. So if we can look at your heart health profile and look at all of these biomarkers as a whole earlier, so that we can really, as I said, be more aggressive about your wellness plan. If you have this high LP little a or high LDL or low HDL, we look at it as a whole, then you are in the driver's seat. And look at this heart disease risk per identical particle increase. LP little a, 6.6, LDL 1. Even though all we seem to talk about is cholesterol and LDL, HDL. There's so much more to heart health biomarkers. And then there's ApoB. ApoB, I'll put this in big letters so that you can see it. Apolipoprotein B, just call it ApoB. This is the number that counts. One, I want you to think about it is it's like the truck that carries the LDL and the VLDL, which is the very low density lipoprotein. The lower the density, the higher the risk because they get stuck to the artery lining. So it's the carrier. So the more ApoB, the more trucks you have, the more they can carry these particles into the blood vessel walls. You don't want that. So more ApoB, more plaque buildup. So this is a marker that should be tested. So I give you some numbers here. Desirable, less than 90, borderline high, 90 to 99, high, 100 to 130, very high, greater than 130. So if you happen to have had that tested, you can have a look at these optimal functional health numbers. Okay, so in summary, these are the markers that are probably not tested on your own heart health panel. ApoB, we just talked about, that measures the number of the cholesterol particles capable of entering the wall. It's the trucks that carry lots and lots of particles versus just one particle at a time. LP little a, it acts as a risk enhancer because this is a genetic risk factor. Now, the other one is particle size. When you do an advanced lipid panel, it's going to include particle size, large particles, small particles, very low density lipoprotein, very small particles. And basically, the smaller the particle size, the more they stick to the blood vessel wall and the higher the risk. The big fluffy particles, they don't stick so much. They pass on through. So particle size is being tested way more. If you go to a cardiologist and they're doing an advanced lipid panel, you will have a whole particle size printout, but a regular lab will not. So here's what's so important. I don't want you to look at isolated biomarkers. It's an accumulation over time. So as I said, ApoB, what was it last year? What was it the year before? Where's the trend? What's your blood pressure over time? What's the inflammation marker, the hsCRP over time? Metabolic dysfunction, your blood sugar, HbA1c, your insulin over time. So you want to look this as a whole because we are a holistic wellness being, and we want to look at the trends over time. Okay, so then another part of the metabolic equation is your thyroid panel, and most of you have thyroid labs done on a regular panel, but it's minimal. So it's usually just TSH, TSH. That stands for thyroid stimulating hormone. What is that? Well, your thyroid is the master gland of your whole body. And thyroid stimulating hormone stimulates the thyroid action to take action. So if your TSH is really high, that means the thyroid has to be stimulated a lot, meaning thyroid is low operating. It's hypothyroid. If your TSH is really small, it's like 0, that means your thyroid is overactive. So TSH is usually the one that is tested routinely, one of the only ones in the thyroid panel. And say it's 2.1, then on a normal panel, they might say that's just fine, case closed. But optimal is 1 to 2.0. See, my optimal levels are actually lower than the normal. because normal is changing as the population becomes more unhealthy. So in fact, if you're at 2.1, I would want to know, wow, okay, this TSH is stimulating, it needs to stimulate the hormone too much, the thyroid too much. So the thyroid mustn't be operating enough. So this is optimal. Free T3. Now, these are all other markers of thyroid health that look at thyroid hormone that's circulating. So this TSH just tells me how hard this hormone has to stimulate the thyroid. These other ones, these free T3, free T4, reverse T3, these all tell me what hormones are circulating in the body. So these are other very important markers. And then there's one, thyroid globulin antibodies. That should be 0. So if you have any antibodies that are working against the thyroid, which is not uncommon, and if you've heard of Hashimoto's thyroiditis, that is when an autoimmune condition of the thyroid, when your thyroid antibodies go high. So these are all little insights into your thyroid, and low thyroid gets often missed because the panels are not exact enough and they're not detailed enough. So I would ask for an extensive thyroid panel if this is something you feel you really want to dig in and look at your thyroid health. And again, you want to look at it over time to see, because the thyroid is the master hormone of the body. It regulates everything. So we really need to see much more than just TSH. Hopefully that helps. Then another one that gets missed that's so important is vitamin D. So this blows my mind that still to this day on a lab report, they say that 30 is normal. 30 is not optimal. I want your vitamin D to be 50 to 80, ideally 60, good number for vitamin D. So if you have a low vitamin D, it's not really a vitamin, it's a hormone, and it's very much related to our immune system and, of course, our bone health as well. But maybe you get sick more often than you used to, chronic pain that won't resolve, and mood. So I have something here to show you. So this comes from a website, vitamindcouncil.org, and they have a list of all kinds of conditions. Now, remember, this is not medical advice. This is simply a report that I found on vitamindcouncil.org, and shows you the link of vitamin D with many, many different cancers. And because vitamin D, of course, is more of a hormone than it is a vitamin. And if you see the number, so 30 is considered normal on a regular lab, right? This number here, 30, 30, 30, 30. So again, if you get your labs back and looks like it's normal, no one pays any attention. But look at what happens above this mark. You need to be at 40, between 40 and 50 to have an influence on cancers of all kinds. And so your ideal marker is between here and here. 60 is your ideal number. That's the number I usually like, I recommend. So if you've got a vitamin D at 30, we really need to dose you up. And I do recommend supplementation for vitamin D because it is very hard to raise your vitamin D level just without supplementation. So it's also, if you have other chronic conditions, you might need to be even higher. But some research is showing us that you can have too high a vitamin D. I think 60 is the number that I recommend. So it's very hard to raise your vitamin D. So 400 IUs of vitamin D raises your vitamin D by only 4. So it might take you from 30 to 34. So you need way higher doses. And so I recommend you talk to someone that knows about this in functional health to give you a recommended dose. And actually, you can go to vitamindcouncil.org. I'm going to put this in the chat box, I think. I'm going to put this in the chat box. vitamindcouncil.org, vitamindcouncil.org, vitamin D. And they have a vitamin D calculator where you can put in there your current blood level of vitamin D, your age, your weight, and they will recommend how much vitamin D you need to get your number up to that 60 level. So takes the guesswork out of it. A very useful resource, vitamindcouncil.org. There you go. Okay, I'm going to close the chat box here. Okay. And then there's another lab marker that doesn't usually get tested, and that's ferritin. Say yours is 24 and your iron is fine. So lab ranges say ferritin between 11 to 200. You believe that? 11. Optimal for active women is 75 to 100. So if yours is 24, it's low. And this can account for you're exhausted, no matter how much you sleep, your hair's coming out, you're always cold. It's an iron storage marker. And so at 24, you're functionally depleted. So another one to really look and see if they're testing it. If not, you need to know what your ferritin is. It's a very important marker. Okay, so I know I've covered a lot of things and maybe a lot of things that you hadn't heard before. But now I want to talk to you about what you can do from here on as an action step. So these are the standard tests that actually drives risks that are not tested. So if I was to pick ones that I really recommend you have, fasting insulin, LP little a, ApoB, highly specific CRP, homocysteine, HbA1c. But the thing is, and I've been very concerned about this in my coaching practice, is I recommend these to people, but then you go, I think I have a chart here, and I just looked on Quest. You can go to Quest and look at the prices of these. The insulin resistance metabolic panel, which is your HbA1c and your insulin, is $169, and your comprehensive thyroid test is $149, and your advanced heart health with ApoB is $215. I mean, their markup is amazing. It's very concerning. Even vitamin D here, $75. So there's a few direct to consumer places you can go to where you can order tests when you know what you want. And you can certainly do that. You can go to directlabs.com and you basically pay for it, and then you take the form and you go to the lab. But recently I'd come across Dr. Mark Hyman, as you might have heard, where he has had an arrangement with Quest Labs for a very low price for 100 plus biomarkers that I highly recommend. And this is called Function Health. You might have seen it. It's a lot on the internet. And I did this myself so that I knew how it worked, and I was very impressed by what they did. And I have not been able to find anything else near the price of this to be able to get a very comprehensive lab markers. Not just once, but they give you a 6-month follow-up of markers as well. So, but I'm going to give you a little personal caveats to this. I want to give you the best opportunity to put into practice what I'm teaching here. And I did these myself, and for $340, I got 116 biomarkers, and these are my actual tests. I had 93 in range, 9 were out of range, 14 were others, they didn't have a range. And then I'll be doing my 6-month follow-up in December, because I did these in June. And I was able to get a discounted link. Now, none of this comes to me, so you have your own portal. All I'm doing here is giving you an opportunity to have what I consider a golden opportunity to really dig into what's happening inside your body. And it looks at so many aspects of health. It looks at autoimmunity and regular blood work, electrolytes, female health hormones, immune regulation, liver function tests, nutrients, does ferritin, does B12, vitamin D, of course, does cortisol, stress and aging, gives you a biological age based on all of your profile, heart health, advanced lipid panel, kidney health, metabolic health, HbA1c is included, insulin is included, homocysteine is included, all the things I've talked about. All the things I've talked about are included in this. And then it gives you a biological age. And it was like refreshing for me to see that I'm 15.7 years younger than my calendar age. So it's very motivating. And then my 6-month, I'll be able to see if that stays the same. So I highly recommend it. It goes beyond the basics. It gives you ApoB, it gives you HSCRP, LP little a, Now, here's my caveat I want to tell you. So I love Mark Hyman. I'm going to stop sharing here for a second. I love Mark Hyman, really think he's done amazing work in functional health space. And he, because of his work, he's been able to work with Quest Labs so that you go and order through a portal and you get a code and you make an appointment with Quest. You turn up to Quest with the code. Don't show any insurance because you're already paid. And they'll draw your blood and you get all the results in your portal. Now, you could look at your results and you get all these numbers, and yes, it can be overwhelming. But what I've started to do is anybody that's interested can set an appointment with me and we can go through all the numbers. We can set your wellness plan based on your numbers. So there's something for you to think about that. To me, this is a golden opportunity. I don't know how long he's going to be able to do this with Quest Labs because it's such a low price. But let me tell you that it is a membership. So you want to have that first one and then the 6-month follow-up, and then you can cancel your membership. You're not stuck on a membership. I just want you to understand what your lab numbers are now. And there's a lot of other tests you can also order. He does offer other things you can add on. To me, the tests are so extensive. Just start with the regular tests that he offers. Start there. For $340, I don't know how he does it, but it's an amazing, amazing price, amazing opportunity. So I want to give you some guidelines because we all have lab tests and no one ever tells you this. So, of course, you always want to have fasting. You make your appointment before 11 a.m. and you fast like 9 p.m. the night before. Make sure you drink at least 1 liter of water of the morning of your test. Don't think fasting means don't drink water. You want to be so well hydrated because FYI, they draw 13 vials of blood in this test. And you want to be hydrate like 3 days before. Really get your blood volume up because if you're dehydrated, your numbers are going to be different than if you're well hydrated. You stop supplements 72 hours before because there are certain B vitamins that interfere with thyroid function tests. This goes for any time you have labs. Avoid seafood 48 hours before because they do mercury and lead testing, and seafood can interfere with that. And of course, fast for 8 hours before. So this is the difference between the Function Health and the standard labs. You get 160 plus, that includes your first one and then the 6-month follow-up. And personally, they give you an amazing clinical report. Amazing. I've been so impressed. I don't know how they do it. I guess on volume because he has so many people doing this. You can upload your past results. No insurance is needed. You do hormones and fertility testing. Fertility testing is an add-on if you want to. Male hormone, female hormone is or part of the standard panel, and heavy metal and toxin testing. So I think I have, okay. So you can scan this. This is a QR code, and I'm also going to put in the chat box here. Let me see if I still have this chat box. I have a link. There we go. So I have a link in the chat box. Now, if you click that link, that will take you to a Function Health portal where you can order for $340. You can order your Function Health tests. It's all on your own. I don't have anything to do with it. It goes into your portal. They are very good at communicating with you when your results are there, when you've got new tests uploaded. I found that certain tests were uploaded at different times. And then if you so choose, when you have all your results, you can always schedule a coaching appointment with me to look at your overall panel and really target in on what the most important aspects are for you to work on your wellness. So this is what I'm doing a lot these days. The Function Health has just allowed me to offer such discounted testing for my clients because biomarkers are so important. And as I said at the beginning, I love looking at numbers. Numbers don't lie. They tell us what's happening inside your body. So I'm going to take some questions. So in the chat box, feel free to type in any question that I can address. And sometimes the If you're thinking about a question, other people are thinking about a question, I can't, of course, answer any medical questions, but anything about any of these things that we've been talking about and any questions you have about the function lab and how it works. Remember, you don't, when you go to Quest, I was actually talking to a client today, and when you go to Quest to have this done, they don't have people anymore at the front desk. You walk up to a little, what is it called? A little computer, I suppose, a little laptop, and you put in your name and you put in the code that they give you. They give you a code to put in, and that's how you register yourself when you go to the Quest appointment. And they're pretty familiar with these function health because when I had mine done, the phlebotomists had heard about function health and they're doing it a lot because it's becoming so popular. Let's see. Hi, Julie. I didn't know you were on. Hey, if you already have all these lab numbers, how are you able to offer your services? Yeah. So if you already have labs, you can schedule a coaching call with me and we go on Zoom. And then you share your screen, your lab results with me. I don't want your lab results. I just need to see them on the Zoom call. And I can evaluate where your major areas for improvement are, and we can have a whole Zoom coaching session around your lab results. We can do that. So you can always this is my email, but you probably already have that. Karen, Karen Wolf.org. There we go. Um, and you can email me and we can schedule a coaching call. You can go onto my website and schedule a coaching call there, and we can look at your labs if you already have those. Yeah, great. If you already have them, that's fabulous. Any other questions? I don't see any more in the chat box here. For Michael in Melbourne, Australia, I would have to look at and Bronwyn. I know Bronwyn, Australia. I wonder if I can't tell you if this is available in Australia. I'll have to see. Michael says, how about getting a calcium score? So a calcium score is something very different. It's a CT scan. So it's a CT scan that's ordered by usually cardiologist or maybe your primary care physician. And very quick, like 30-second CT scan that looks at your calcium. So tonight we're looking at biomarkers. So calcium score is a whole different thing. Yes, Bronny, I missed the first half of this. Yes, you will get a copy of the recording. So everybody, Bronny, isn't that lovely? So everybody in the United States, if you know someone Bronwyn, the nickname is Bronny. Isn't that just not sweet? In Australia, we shorten everything. Oh, thank you, Bronny. That's so sweet of you. I'm going to find out if this Function Health is available in Australia. I'm just not sure. It wouldn't be Quest Lab then. It would be someone else. Um, but yes, everybody that registered for this will get a copy of the recording because I know I talked about a lot of numbers and different names. So you'll be able to go back and take some notes. Certainly for the next time. Now, here's the other thing. If you have a functionally health inclined health practitioner and you ask for LP little a and HbA1c, they might be able to code your lab request form so that it's covered by your insurance. But you want to really work with them closely on that. I'm just offering you Function Health because, wow, it's the best deal in town that I know of. If your healthcare practitioner is not able to code and have these covered. Julie, I'm out of range of several areas. What does the coaching call include? Julie, the coaching call is just very straightforward. We go on Zoom. I look at your numbers. We talk about where your risk factors are, and we set a plan. So, of course, a wellness plan, I don't prescribe medication or anything. So we just kind of zone in on what you have to very particularly focus on. All right. Any other questions? I'm gonna stop sharing here. You might also, I know some people were asking about, I can go to my website and show you where on my website. On my website, you would see book a session. There it is, there it is, there it is, there it is. I'll just share Zoom. Mhm. It's probably easier. Can we schedule with you after viewing the recording? Yes, of course, Cheryl. Ah, yeah. I mean, this is the work I do. Uh, I love the numbers align so well with my health coaching because we can reevaluate. We can set a plan and we can do the numbers again and see what the improvement is. And yes, you 6 months is a very good turnaround time. You can change numbers in 3 months. You can change certainly in 6 months is usually the follow-up that I recommend. Tammy asked, how is it to turn numbers around? Can you do it in 6 months? Absolutely. Yes. Um, Michael says, my GP assists me with what tests to use. Yay, good for you. Well, now you know the numbers and now you can work with your GP, of course. I love that. I was a GP in Revesby in Sydney, in case any of you know where that is. So that's great that you can now you know these what to ask for. Yes, you can turn the numbers around. Love that. Okay, I was just going to share my screen one more time and show. This is one way you can book a session with me right here that talks about a tune-up, quick tune-up for one session or book 4 sessions, but it's probably easier that you contact me since you're on this webinar and I'm going to be offering a special to people on the webinar and let you know what that is when you email me. My friends and family and webinar rate. So I will let you know that. Just email me if you would like a session like Julie, just email me and then we can set up a way to make that happen. Any other questions? No? Okay, so boy, we finished early. Yay. So I am going to stop the recording.